Why you're not running pain-free after ACL surgery. I've spoken with hundreds of people recovering from ACL surgery, and what's one of the most common complaints that I hear? John, I need help. I can't run without knee pain. My first piece of advice, stop blindly following your surgeon's protocol. Just because it's been 12 weeks in surgery does not mean that you're actually ready to run. A piece of paper knows absolutely nothing about you, your knee, and your unique situation. It's an arbitrary guess at best when this might happen. So what should we do instead? I'm going to break this down so you can identify the bottleneck and root cause as to why, as well as give you a game plan to attack it. And it really boils down to 4 main components. Number 1, this is such a foundational milestone that should be achieved within the first 1 to 2 months after surgery, yet I see so many people who are 3, 6, 12 months or more out who don't have it. And that's full knee extension, range of motion that's 100% symmetrical to the non-surgical knee. Yes, we need symmetry. These people typically fall into 2 buckets. Either they know that they don't have full extension and they're struggling to get it back, or they were told by a healthcare professional that they do have it, but they really don't have full extension. Getting your knee to 0 degrees or flat is not enough if your non-surgical knee hyperextends. We need symmetry. Why is this so important? If your knee isn't fully straight, you won't be able to walk with normal mechanics. And if you can't walk with good mechanics, guess what happens if you try to run? Also, if your knee isn't fully straight, your quad muscle doesn't work as well. Which brings me to point number 2. Having adequate quadriceps muscle strength. This is such an important metric that needs to be tracked throughout the entire rehab journey. After this surgery and injury, the quad takes the biggest hit by far. So we need a proper research-based way to measure strength. The good old push into my hand test tells you nothing. Instead, we need a test that gives actual numbers. So this can either be an isokinetic dynamometer, an isometric dynamometer, or a repetition max test on the knee extension machine. Using these numbers, a qualified ACL physical therapist will be able to crunch those numbers for you and let you know exactly where you stand. Strength affords you the capacity of your knee to tolerate the forces of running, but just because you have enough quad strength doesn't mean you will run pain-free. Which brings me to point number 3. You need to be taken through a structured pre-jogging preparation program. This needs to include introductory jumping and plyometric drills. Think of it this way. Running is a series of mini jumps. So if we need to prepare the body for this, if I wanted to run my first marathon, I wouldn't start by running a marathon. I would run a mile, then maybe a 5K, then a half marathon, then a full marathon. This is no different. Think about it. You likely haven't ran in 4 or more months. Why else is this so important? Depending on the speed, the forces of running on the knee joint range from 5 to 8 times body weight. So in addition to the amount of loading, it's important that we also prepare for the increased rate of loading on the knee. So think of traditional strength training. The speed of the exercise is so much slower compared to running. Number 4, last but not least, there needs to be no swelling, no pain, and no increase in joint soreness with daily activities and the structured pre-jogging program. Pain, swelling, and joint soreness are your knee's way of talking to you. If any one of these things are occurring during or after an activity, this is your knee's way of saying that it's not happy with what you're doing. So if your knee is getting cranky with stairs, squatting, walking, and even jumping, how do you think it's going to handle running? That sums it up. If you're being told to run strictly because of a piece of paper from your surgeon's office, this is a problem. Proper testing, proper guidance, proper program structure. If you found this useful, be sure to hit that like button and subscribe for more knee pain and ACL recovery tips.